Thanks for listening to the Wild Health Podcast. For the foreseeable future, you're not going to hear our normal intro or outro here. We're going to be releasing episodes very frequently as things are changing. This channel will be used for a very specific purpose. Number one, to communicate with our patients. We're somewhat overwhelmed, and the more we can communicate breaking news and recommendations from us to our patients all at once, the better. So if you're a patient, we're here for you if you need us, but if possible, please tune in here so we can both keep you up to date and conserve our time for the most critical tasks. Feel free to share this with friends and colleagues as well. Number two, we've organized as a group. We have infectious disease specialists, ER doctors, critical care doctors, and in total dozens of MDs, PhDs, and frontline clinicians who are going to be constantly evaluating the news and emerging evidence. We're then going to summarize and translate that for you here every day on the podcast. The speed of change with the circumstances will make us look foolish at times, but we're committed to pouring all of our resources and energy into doing what we can to help and make a difference. You can also follow our updates at wildhealth.com or our Instagram account at wildhealthmd. And if you're a patient, we're here for you. Please tune in here for the updates and let us know how we can help. Good evening. Today is Sunday, March 29th. This is Dr. Matt Dawson with Dr. Jeremy Stitch. Thanks for joining us for your daily update. In the United States, as of this morning, Johns Hopkins reports 125,313 confirmed cases and 2,197 deaths, representing a 19% increase in cases and a 28% increase in deaths from the day before. The case fatality rate is 1.75% and has been incrementally increasing over the past few days, although it remains much lower than the original reports of 7% or higher. I apologize if you hear the wind in the background. I'm sitting outside because I can't stand to be inside any longer. Globally, the U.S. continues to have more confirmed cases than any other country in the world and remains the only country to surpass 100,000 cases, although Italy is close behind with more than 92,000 cases. Data from the Financial Times shows that the death rate in the U.S., Italy, Spain, France, and the U.K. are increasing more rapidly than they did in China, with the U.S. death toll continuing to double every 3 days.
And before we jump into the U.S. news, I want to take a moment to thank all of our volunteers who are tirelessly pouring through all this data, all the articles, research, and the news to help us compile this information. It is an absolutely huge undertaking. And if you would like to join that team of volunteers, please reach out to Matthew Gomez at wildhealth.com. That's MATTHEW GOMEZ at wildhealth.com. So in the U.S. news, the New York Mayor, Bill de Blasio, has stated that the city has a 1-week supply of medical supplies left and even fewer ventilators, which is somewhat dire considering the spike in cases there. Despite reports that President Trump was considering quarantining several states, no federal lockdown or quarantine is actually in place yet. Instead, the CDC has issued a travel advisory on Saturday night, advising residents of New York, New Jersey, and Connecticut to refrain from non-essential domestic travel for 14 days. Another very sad report was out of Chicago. They reported the death of an infant who tested positive for COVID-19 on Saturday. This is the first recorded death of a child younger than 1 year with the virus within the United States. There's probably more details on that, but right now we just know that they tested positive.
Jeremy, I think it's important to put that in context a little bit as well, though, because in Illinois, right now, even though that is a tragic case, we still know that over 65-year-olds represent about half of hospitalizations, half of admissions to ICU, and 80% of the deaths. And currently there are about 3,500 COVID-19 cases in Illinois and 1 death. And then we also just went over the U.S. numbers, about 125,000 cases in the United States, and we've had 1 infant or child death. So it's still extremely safe for children right now. We did a whole podcast on this about how children were tending to fare pretty well during the pandemic, and I think that's still important. This 1 death of an infant is a tragedy, and we have to remember and have compassion for the family here, and it's really important to note it, but at the same time, I just want to make sure that parents don't overreact. We've, for the past few weeks, been telling people they probably need to react more strongly than we were seeing them. But what I wouldn't want is for parents to stop letting their children go out to play. We don't need big gatherings of birthday parties or other celebrations like that, but just going outside to play and letting them be a kid, I think, is still important in light of the actual risk with kids right now.
That's a great point. And with the details somewhat inconclusive at this point, we also know that there's tons of cases around the U.S. where people are found to have COVID or findings on X-ray or something like that when they're presenting for something else to a hospital. So the details on this could be a little bit early to conclude that COVID was necessarily the cause of death too. It might just be that this child had COVID, but is one of the many people who are asymptomatic. We just don't know enough information.
Yeah, it's a great point. There are going to be deaths every day in the United States from COVID. There will also be children that die in the United States. That just happens each day. And with the rising number of COVID-19 cases, there's going to be some overlap, whether or not it was the actual virus that caused the death or not. So it's a great point.
Well, moving on in other news, researchers at Mount Sinai Hospital have announced this week that they will officially begin plasmapheresis treatments on critically ill COVID-19 patients after receiving approval from the FDA. And this treatment involves transferring antibody-rich plasma from donors that have recovered from the virus to patients that are currently ill, with the expectation that the donor antibodies will neutralize this virus. They note that the process was used successfully in China and was reported that some patients improved within 24 hours with reduced inflammation and viral loads, as well as better oxygenation levels. It was a fairly quiet weekend, as is to be expected from the research end. I do want to mention an article that came out of Obstetrics and Gynecology on March 19th. We're going to be going into this in a lot more detail, but this is specifically concerning coronavirus disease in 2019 and pregnancy, and responding to a rapidly evolving situation. So there's going to be a follow-up podcast specifically about this, and we want you guys to just stay tuned for that because it's going to go into a lot more detail. I just want to mention that was released relatively recently, and we'll have some more information.
Yeah, we're getting a lot of questions about COVID and pregnancy, and so either on Tuesday or Wednesday of this week, we'll be releasing a podcast with Dr. Hillary Seeger. She is an OBGYN, the director of her OBGYN service at her hospital, her community hospital. She also has a master's in public health, so we asked her all the pregnancy questions that we can think of, and questions about if you are pregnant or if you're considering getting pregnant, what you need to know and do and what's going to be different. So that'll be released in just a couple of days. There was an interesting article that I saw on CNN today from Jackson Memorial Hospital in Florida, Florida's biggest hospital. They interviewed a trauma physician there, and this article caught my attention because I've been to Jackson Memorial Hospital. I taught a course there a couple years ago. It's an extremely busy place. They have a level 1 trauma center that sees an incredible amount of trauma. And this trauma physician made the statement that they are slowly descending into chaos. He said, we keep drilling and preparing, but it's already taking a toll on our staff, both emotionally and psychologically. And the reason for this is he goes on to talk about how in the ICU, everyone knows a patient has COVID. They have time to don equipment before going into the room, but in trauma, it's not like that. We get a trauma that comes in. Sometimes we have minutes of notice, and that's it. And with trauma, we rely on literature, research, and training, and they've got these protocols that have been developed over years, and everyone's very comfortable with this kind of hectic situation because we've trained for it, and we just practice and go over and over. But the physician says they're, quote-unquote, flying blind in a storm without instruments right now, just because there really aren't any guidelines on how to treat a trauma patient who comes in and has COVID. And you kind of have to assume everyone has it coming in now. And it just creates a very different situation. And so I bring this up just as kind of our PSA today, our public service announcement, to say, look, today we're here in Kentucky, the weather's beautiful. We want to be outside doing fun things, and we should. But be careful. This is not the time to come in as a trauma. It's going to be bad for you. It's going to be bad for the trauma team. It's going to put more stress on the hospitals. So I'd say maybe keep the four-wheeler in the garage for a little while, decrease risky behavior. Alcohol, we know what both, I know a lot of people probably are wanting to drink a little more now with the situation going on, but alcohol is going to both suppress your immune system and increase your likelihood of injury. So today is a short update. I just want to tell everybody, as the weather's getting nicer, enjoy the great outdoors. That's really important, but be careful. It's not a good time to go to the hospital for anything. Even a minor injury could end up having a bad outcome if you go to an emergency department and end up catching the virus by being in a high-risk environment like that. So this morning we released a podcast with Ben Greenfield on his biohacks, best top biohacks during the pandemic to try to stay healthy. Tomorrow morning we're releasing a podcast with Dr. Matt Cook. We've had a lot of questions recently about ozone and its effect, and then later in the week we'll be releasing a podcast on pregnancy and other topics as well. So stay tuned, and thanks for listening.
Thanks so much for listening to this COVID-19 update. Please send us your questions or follow along on Instagram and Facebook at Wild Health MD. And just to be clear, this is not medical advice. No patient-physician relationship has been established, and this resource is really for general informational purposes only. And finally, if you want to spread the word, please send this podcast to friends and family and give us a review on iTunes. Thanks again, and stay safe.